Let's Achieve Change is a podcast by Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. My goal is to make you aware of various health and wellness topics. Every 2 weeks, Let's Achieve Change will appear with episodes with various topics with interviews and narratives, especially as it pertains to health and wellness and chronic pain and disabilities. I propose to be the voice for those silent sufferers out there. If you'd like to learn more about Let's Achieve Change or Metanoia Education and Wellness Center, please visit our website at changeachieve.com. Thank you. Hello. Thank you for joining me today on Let's Achieve Change. I'm Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. Listen, if you want to make some changes, you have tuned in to the right podcast. Now listen, don't forget to hit that notification button so that you can subscribe and you won't miss any future episodes on some changes you might want to make. Hello listeners, let's do a recap from the last episode. The last episode we mainly tried to cover two questions, one being does proper timely intervention affect chronic pain in order our body structures, whether it be soft tissues like muscles, ligaments, tendons, or our bony structures. As I mentioned in the last episodes, the non-elastic and elastic fibers may never return back to the level of performance, the prior level of performance. And also there might be those supposedly dormant microscopic muscle fiber tears, okay, that haven't been totally addressed. Also, the second question we kind of brought in the last episode was the topic on post-traumatic osteoarthritis. I quoted the earlier statistics of at least 12% of osteoarthritis cases are results of post-traumatic osteoarthritis, and I believe that figure is probably greater at this point in the year of 2024. Okay. Before I bring on our guest today, Christine, I do want to mention that, these guests, as they come on, they're going to have some commonalities, okay? But they're also going to have some unique issues in that. So these episodes will continue to unravel, and they're just going to continue to unravel with so many issues that need to be addressed because of lack of public awareness or just a lack of, discontinuity that's going on in our society today. Okay, so I do want to mention before I do bring on Christine that we want to definitely address the for the last 2 weeks we want to address the issue of the timeliness of intervention. So we want to speak to the fact that is it the timeliness of intervention or is it the type of intervention, or maybe it's both. And as I'm seeing a trend, it is definitely possibly both. But what I want you listeners to do to consider is let's examine ourselves. Let's say first, we as individuals, we need to weigh in. Are we the culprit for the improper intervention? What do I mean by that? For example, are we showing the lack of consistency of application of recommendations that are being made to us? Are we performing the ostrich effect? And what is the ostrich effect? That's the effect of we sticking our head in the sand and thinking that by ignoring the issue, rather resolving the issue, okay? But realizing that we'll be, whether it's days, months, or years later, what happens? That issue has not been resolved, and it has become even greater or greater consequences. Okay. Then we have the situation of whether is it because of maybe that's being the reason for the delayed intervention, causing the problems with chronic pain and problems in the structure, or also could it be because of the ineffective maybe surgical procedures or the lack of surgical procedures that are being done, or maybe it's the improper guideline of a medication regimen, or maybe a discontinuity among the therapists and other medical professionals, or maybe it's because of the systems that are intact whether the systems, the delayed, referrals, the delayed, follow through is some of the reasons. Okay. So as we continue these episodes, we want to continue to dive into more of some of these trends that seem to be prevalent, and how they do definitely affect the type of intervention and the results of chronic pain and or results of problems with the structures because of lack of follow through. Okay. I want to say that, as Let's Achieve a Change episodes continue to progress, we want to make sure that certain topics are brought up and are addressed. For example, last episode, if you listen, Charles brought up the fact that he had to use intensive, well, he didn't have to use, but his regimen was the intensive use and long-term use of steroids. And as a result, that caused deterioration of his bony structures. So that would be a subject we will also return back to at a later date. Okay? So I'm going to bring on Christine. Christine was a registered nurse for many years, and her life was dedicated to the caring of others. So I think her story is worth telling. Good evening. Today we are going to be talking to Christine, and Christine suffers from chronic pain. And Christine, before I dive into the questions, first thing I'm going to say is thank you so much for the opportunity to speak to you.
You're welcome, and good evening to you also.
Thank you so much. Thank you so much. Okay, so will you please tell our audience, tell them first of all, because I'm quite sure you didn't have this chronic pain all of your life. So just give us a little bit of a summary first of, when did it start? What happened to bring you to the point that you are at this point?
Well, I was working a night shift. Mm-hmm. And I tripped over a fall mat, believe it or not.
Okay.
A mat that we use to prevent patients from hurting themselves if they fall.
Okay.
And I was leaving this room, tripped over the mat, and don't remember falling.
Okay.
And don't remember landing.
Wow.
But when I woke up, my head was on the edge of his bed, and my arm was folded across my chest, and I was out.
Wow.
So they all of my coworkers and so forth came in and woke me up because I had no idea. And they said, "We heard you fall." And I said, "You heard me fall? Why am I on the floor?" I didn't even remember.
Well, let me ask you something, because I just want, don't lose your thought. But did you actually hit your head, you think?
I did.
Okay.
I sustained a concussion.
Okay. And did you lose consciousness as well?
I did.
Okay. Go ahead. Now I got a clearer picture. Go ahead. Keep going.
Okay. So they aroused me, slapping me in the face and all those things, and calling my name. And took me down to the emergency room, and I was x-rayed and here and and diagnosed with a concussion and a partially torn rotator cuff at that time. Okay. And
can you share with us how long ago that was?
Oh my God, too many years. It was 2019, October 11th.
Okay. So we already talked about 5 years. Okay. All right. So now that we have some idea what we're dealing with, before this, were you pretty much, healthy? Did you have full use of your arms and everything?
Oh yes, I had full use of all my extremities. Yeah.
Okay.
I was active. I was a nurse. I loved gardening. That was my favorite thing to do. I gardened. I took care of my kids. I drove. I had no limitations.
Okay, good. That's what we need to make sure of. So based on that, I say to people, from my observation, just to qualify myself, I've been, treating chronic pain for more than 40 years. But I say to people, I have observed that, it changes you personality-wise. And so, you just got finished expressing to us how active you were, what you love to do. So how do you think it changed your personality? What do you think is different about yourself as compared to before?
As time went on, I became depressed.
Yeah.
And my husband noticed it, but I kept denying, no, I'm not depressed. I'm just trying to get used to what I'm trying to get used to once they diagnosed me with chronic pain diagnosis. And they set me up with doctors to be evaluated so many times. And they all came to the same conclusion, but they all had a different treatment plan for me. So that was very depressing, and I was very angry. I was very short-tempered with everybody, and I isolated myself a lot,
Yeah. So, and then that's not all your fault. Believe it or not, this is why I'm trying to get these publications out. I think, not to get into too much of that, but I think a lot of the fault is in the medical professional field, and in public sector as well. The lack of understanding, the ignorance in the area.
I agree.
Yeah. So do you feel that the medical traditional providers have helped you at all? If you don't feel they have, then comment.
Initially, I did because I was in a lot of pain. So I used a lot of pain pills, a lot of different pain pills, because I'm very sensitive to medications. And they couldn't give me anything really to stop my pain. What they were doing was treating my pain with narcotics, and I hate that. And all that did for me was make me sleep. I went to bed in pain. I woke up in pain. It did not stop my pain. So complaining to the doctors, complaining, and they eventually said, "Well, we're going to take you off the narcotic." I said, "Well, that's good, because I never took the narcotics. I didn't like the way they made me feel." So I was kind of hooked on Tylenol.
Oh, okay.
Yeah, and then they told me, no, you can't take Tylenol. It has so many side effects and so many complications. And I said, okay, but I cannot take narcotics. It wasn't that I couldn't take the narcotic. I would not take the narcotic.
I got you. Yeah.
It made me drowsy, made me sleepy, and I lost half my day.
Yeah.
I was an active-minded person at that time, and I just did not like sleeping for long periods of time. So that changed me a whole lot. After I did not take the pain medicine, then of course here comes my pain back again, and I'm irritable with everybody. So I just kind of kept myself away from people and didn't go out of my house too often.
So how do you
deal with me?
So how do you think your family members or your peers or anyone else do you feel as if they disappointed you or the way they reacted to you, or tell me about that?
Well, my peers, they only wanted to know when she was going to be able to come back to work.
Yeah.
And I had worked for quite a while until I just could not work anymore, and they just wanted to know why I couldn't work, and then they would call me all the time asking me the same what I thought were crazy questions. They were so repetitive, so I just stopped answering.
Give us some of those repetitive questions, because this is very important. What were some of the questions?
Well, how are you doing now? You fell like a month ago.
Yeah.
What are they going to do? What's the doctor's plan? How much medicine are you taking? Are you taking all that medicine? Because, that gets you hooked.
Yeah.
When are you going to come back to work? When are you going to get active with us again? Because I was, going out with them once or twice a month.
Yeah.
And they kind of got repetitive, and I just kind of stopped. How bad is your pain? Can you move your arm? Can you use your arm?
Yeah.
Is it any bad? I mean, you fell like last year, and your arm is still in the same position. So I just got tired of that.
Yeah.
I just kind of isolated myself from them, and I told them, just I'll call you when I'm feeling better.
Yeah. And that is the consensus. And, it's unfortunate, but that is the consensus. I know my brother, he's going to be probably one of the people I dedicate this book to. He's going on to heaven now, but he would say once his ordeal was so traumatic as well, it changed him dramatically. And what he would say was, and it's going to be quoted in the book, he would say people give you 2 weeks, and he was so clear on that. He said, after 2 weeks, they lose tolerance for whatever was wrong with you, and they feel like you should be over it by then. So he said people give you 2 weeks.
100% with your brother.
Yeah. That's just what he used to say all the time. Okay.
My family did the same thing.
Yeah.
I can't touch your arm. Oh, you can't use your arm, because I was a cook. I like to cook, and I like to stir around in the kitchen. And when they came over to the house, before I got injured, I'd have food ready. So then it just got, well, when are you going to start back to cooking? First off, you better get past that depressive stage to do anything. And then secondly, I don't care about cooking for you anymore. I cook for myself. So it got so hard to deal with people. So I just kind of, my husband could tell you, I just kind of stayed in my room, sat up in the chair, read a book, a lot of books, worked crossword puzzles and all those kinds of things.
Yeah. Have you ever heard the term?
I wasn't able to drive. So I couldn't go anywhere.
So how long was it before you were able to drive again?
I got hurt in 19. I was able to drive in latter part of 22.
Okay, so 3 years. Wow. Now, did you have to have surgery at all on the shoulder?
I did have surgery. What I thought he was going to repair, he did not. He said that I had a nerve impingement, and he went in and repaired that. But they didn't do anything with the rotator cuffs. So, because he said that, women your age, unfortunately that's for all people over 60, women your age and people your age in general, he said you should get a spontaneous rotator cuff tear. I had never heard that before in all my years on this earth and all my years in nursing. I called all the doctors that I knew, and my brother-in-law is a doctor. I talked to him, and they said, well, no, that's not a usual thing, but it does happen. And I said, okay. So when I told the doctor, and he got a little miffed at me because I quoted some of his colleagues.
Yeah.
But the general consensus was he was not going to do any surgery on my arm. It wasn't going to do anything. It wasn't going to help. And that was a general consensus too, because I waited so long until the doctor said it might not do anything but cause me additional pain. So,
well, let me ask you something else. So, did you actually go to another surgeon to consult whether they thought they could help you?
Yes, I did.
And so, today,
I'm going to tell you, the first two surgeons I went to after my initial doctor told me that I should have had the repair done. That would have been the first thing they did.
I would thought so. Yeah.
But since I had waited so long, and I was on the workman's comp, let me back that up. They were the ones in charge of my care. Yeah, they gave me a second opinion, a third opinion, but it was all workman's comp doctors, so they all said the same thing.
So this is where it changes, and so I didn't know this part. That's where it changes. So that's another system that we have to address at some point, because that's a whole nother can of worms. Okay.
Yes,
and so that is, and so our audience, just make sure our audience understand this. Like I said, that's just so much to talk to get. We couldn't even get into this topic really. But the problem with workman's comp for most people is that it's so long and drawn out before you get approval for anything.
Oh my goodness, yes.
Yeah.
They had me going from one side of Atlanta to the other. My husband had to drive, of course. And in the rain and the storm, we were driving, trying to find all of these so-called expert doctors. And they all said the same thing. I should be able to use my arm. I should be able to dress myself, which at one time I couldn't even dress myself. I couldn't even comb my hair with my left arm. So, it was kind of trying to manipulate that with one arm. It's kind of difficult for me. Plus, I was angry all the time. So they all said, the workman's. I went to 3 of them. Then I went to a doctor outside of workman's comp, and they all told me, well, if you're going to an outside doctor, you're going to have to pay. I said, I don't care. I have insurance, and plus, I worked.
Exactly.
I got a little money. I could pay a consultation.
Exactly.
So, but when I finally did get to the right doctor, because once you say workman's comp, doctors don't want to deal with you.
Yeah.
That was horrible. I could not accept that. I was just so upset, and I talked to my lawyer about it, and he said, well, yeah, Christine, that's the way it is. Nobody wants to do what the workman's comp doctors didn't do, and they're not going to tell you the truth about that. I said, wow. And after bouncing back from doctor to doctor, you just get depressed. And that made me even angrier.
Of course.
I finally got one, and he said the same thing almost. He said, no, you should have had the surgery. It's the first thing he said when he saw my x-rays, that I should have had the surgery, but right now I probably have a lot of secondary issues, bursitis, arthritis, all that setting in, and my ligaments probably have shortened, and if the surgery would be too involved, and so forth and so on. And I said, okay.
So, I was going to talk to you about gaslighting, but I think you pretty much summed it up. Have you ever heard the term gaslighting? Yeah. So, what's your impression of that term? Because it sounds like you've already been gaslighted at least once or twice.
Well, yeah. My impression of the term?
Yeah. What does it mean to you?
Ridiculous.
What does it mean to you? What does that mean to you?
Well,
But let me say it to you. Let me say it to you.
To by a group of the same doctors to tell you the same thing, to shut you up. They think you're irrational. They think you're crazy because you're complaining about the same thing all the time.
So more of a dismissive type of behavior.
Very much so.
Okay.
Yes, that describes it exactly.
Okay. Okay. That's what we're getting from most people. Yeah, dismissive. So you do agree that you've had that experience as well.
Oh yeah.
Yeah.
Sure.
Okay. Just want to make sure you go on record saying that, because I can't just come out and say that based on what I have just seen. I want to get people to actually express that, because I know that is a fact, but I have to have people to back that up. Okay. So now that you are, I guess you are in a therapy program, and we don't have to speak to where you're going at this point, because we don't want to call that in at this point. But basically, are you still under a particular doctor that sent you to that therapy place?
Yeah, well, I'm under the orthopedic doctor. Yeah, but
so no longer Rutgers County
neurologist. I'm no longer under him. So he sent me. My orthopedic doctor sent me to the neurologist to see why my pain had not improved. And I had already, as I said, gone to the other doctors to try to figure out what else was going on and what else could they do. But so yeah, I am seeing that same doctor. I trusted him because I've known him for years. He was my husband's doctor, but he wasn't the one sending me to all of the other doctors. It was the workman's comp panel.
So is he an orthopedist or is he a neurologist? The one you're going to now, is he an orthopedic or is he a neurologist?
I go to two of them, orthopedic and a neurologist.
Okay. So the one that sent you to therapy, is he the orthopedist or the neurologist?
Orthopedics.
Orthopedics, okay. So did they ever go back and do any type of nerve conduction studies or EMGs to see whether you have any nerve injury?
They never did an EMG. All they did was, I've had so many CT scans and MRIs of that area. I feel like I light up at dark. But no EMGs were done. They just tactile movement and touching my arm because it gets cold. My arm gets so cold, and of course that's a nerve problem, which is why I go to a neurologist. And he's he's got me on a plan. That's getting better. Physical therapy was supposed to be aggressive enough to. I have a frozen shoulder. Let me back that up. All the long distance in my pain plan and my pain, my dealing with my pain. I've developed a frozen shoulder.
Okay.
That way. So I can only do so much movement in it. So I have responded well to the physical therapy in that respect, but there's still a lot of limitations. And so I went to a different physical therapist initially. I went to them for about a year and a half, and they said I had reached my plateau with them because there was nothing else they can offer me. They could not get my arm to move. And so now they sent me, my doctor has me going to a new therapist, which I think you are part of that, but the other ones that before you were doing fairly well. And then I think they just got used to me coming and just gave me the list of exercises to do and told me to go do them. So that's what I was doing.
Yeah.
So that's another thing that works on your psyche, because now you're going to all of these different physical therapists and they're saying, well, there's nothing we can do for you. We're limited in what we can do. You might just have to get used to not using that arm. My God, that was one of your doctors, one of your therapists actually suggested I go to a psychiatrist. He said, because this might just be all in your mind. I said, so this pain in my arm and the fact that I cannot use my arm is in my mind. Wow. So I addressed that with my neurologist and my orthopedics, and they said, no, we know how well you are, and they don't think that my psyche has gotten that confused. I said, I know I'm not crazy. I know this pain is real. I said, because I don't complain about it does not mean it's not real. I just know people are going to look at me like I'm,
Yeah, They just get, they feel as if they have no more answers, so they
because
pretty much
they don't have the answer.
exactly, and that's exactly what it is. Once a person feels they don't have the answer, then they want to then brush it off on the other person. That's what they usually do. Reaction. Yeah, that's what people do. So let's go on to the next thing, because I think we've pretty much have hit that one right on the nail. Let's talk about how you have to compromise in what you do. Does it take you longer to do things to get yourself ready for outings? When you do go on outings, tell us that
I have to plan. Yeah, it takes me longer to get prepared to go anywhere. My limitation is raising the arm, so I can't lift things from the refrigerator without my husband with my left arm. But I've managed to compromise. I've managed to cope well with it. I mean, I have to. There's nothing. I have to cook. I have to clean my house, so I do it all one-handed. Takes a little longer, but I do. Yeah. Dressing myself takes. I try not to put on anything that requires a backward zipper. But I'm doing well with that. I think I've managed to cope quite well with that section of it. And so I'm basically independent. Like I said, initially for the first year and a half, almost 2 years, I was dependent on my husband to do everything for me, and that made things worse for me because I can't stand to be dependent, especially when I overall am an independent person. So my mind tells me, you can move that left arm, put that arm up there and wash your hair. But the pain says, no, not tonight.
Okay. So I was
really limited.
So I see how it affected you physically, but do you feel as if it affected? And sometimes people get little apprehensive to talk to this vulnerability, but do you feel it affected your relationship with your husband and maybe your finances? Do you feel that those areas of your life was affected by your change?
Yeah, of course.
Can you speak on that?
Finances. I'm a nurse. I was a nurse, and I was a practicing bedside nurse. So I couldn't do anything. I couldn't even put a blood pressure cuff on a patient's arm because I couldn't use my left arm.
So you lost that income. You lost that income.
Definitely affected by that greatly. It's changed my whole thought process of what I can do and what I can't do. Even when I was working at the hospital, when I went back to work, the doctor said, well, you can go back to work and just don't use your left arm. Okay. So I'm answering the telephone and trying to put charts together, but I couldn't do any bedside nursing. I couldn't even get in contact with a patient. Had no contact with the patient at all. And that was my life. I couldn't imagine doing anything else with bedside nursing. So then they put me in telemetry. I don't know if you're familiar with telemetry.
Oh, sure. Definitely so.
I did telemetry for about 3 months, and I was doing pretty good. But then they wanted me to work the night shift.
Wow.
And at nighttime, they turned down the heat and turned up the air. My home was so cold. I was sitting in there with a coat on, a scarf around my neck, glove on my hand.
So let's talk about that because some people don't.
Due to the fact that I can't do CPR, you can't practice as a nurse if you can't do CPR. And as far as my husband, the relationship with him, but I can't lay on my left side. I can't turn over on my left side. So we had to find different ways to smooch.
And that's hard. That really is hard.
It was very hard.
Okay, well, I think you've answered a lot of things, but one thing I want you to really give us is if there, because it sounds like, society in traditional medicine has failed you in some capacity. So what would be your suggestions if the world came to Christine and said, we give you the power to make some changes, what would be some of the things you would suggest that would be changed that could make a difference? What would you say?
For me, I think that the world should do my surgery on my arm. I know I'm not going to find anybody now to do it because of what all I've been through. I think the doctors should have listened to my pain more than they listened to each other.
Okay.
I think I should have had, like you said, an EMG. I even asked them to do one, but they said no, it wasn't necessary. And you can't get one without a physician's order.
Of course,
I think that they didn't listen to me, the patient. They listened to me, the diagnosis.
So that's the bottom line. That you feel that the medical professionals need to listen more intensely and mindfully to the patients.
Yes. And not put you in a category where, oh well, she's just belaboring. She doesn't want to do anything. She wants to get this check. I told them they can keep the third check. I wanted to use my arm. If I had to take a choice between using my arm and getting that little check they gave me, which was a very little check, I would have taken anything to repair my arm. I mean, it was horrible, the pain that I went through, and nobody cared. I went to the doctor every month. Every month I was in the doctor's office. Sometimes twice a month I was in the doctor's office for the last almost 3 years. And all of them telling me the same thing. Well, this chronic pain now, it's CRPS, and chronic regional pain syndrome. And they said, well, there's nothing you can do about it. It goes away, but it might not go away for 3 years. And then one doctor said, oh, well, you've had it for 3 years. Now it may not go away for 5 years. So this is my 5th year, and it's still there.
Yeah, we got to get some kind of resolve for you with that. We're gonna have to work on that. I'm
getting the stellite injections in my neck because apparently when I hit my head on the bed rail, I damaged a nerve in my neck. And that nerve is the one that controls the movement in my shoulder. So I'm told. So when I get those shots, for about 3 months, I can't raise my arm like I want to, but it helps the pain. I mean, I can relax at home and taking Tylenols and go to sleep, for a few hours. But
so are those Botox injections, or are those steroidal injections that they're giving? Steroidal. Okay. All right. Okay, so I'm going to sum up to say pretty much that you would not listen to, and so things that could have been done earlier were not done, and that's what probably was one of the main issues with you.
Exactly.
And so I'm going to sum up to say that. Okay, so I'm trying to get people to give me a good answer to this one. Basically, it may sound kind of morbid, but if you were to go on to leave this earth, and we had to have an epitaph, to attach to you, like for example, my brother, he always, everybody, if who knew him, he always said, "Grace and peace, dear ones," or he said, it's just nice to be nice. So you heard those things, you would know that was me. I say it all the time. It is what it is. That's me. That's one of my things I say all the time. It is what it is. What would be yours? What would be yours?
What would be mine? I always told my kids and my friends and my family, because I would always ask questions, and I always questioned everything. And so I think mine would be, she questioned everything. Nobody could you could walk up to me and say, "Christine, the sky is blue," and I would have to look at it and go, "Oh, really? Well, what color blue is that? Does that indicate a rain or storm or snow?" I'm that type of person. I mean, you just can't walk up to me and tell me. So they would always say, I ask questions, and that's what I tell my children. All they can tell you is yes or no. Ask questions. I don't take anybody's word for things. You tell me today, like we're doing right now, you had asked me to do this, I said, I had to really sit there and say, do I really want to do this?
Exactly.
Something that I want to share with the world.
Exactly.
Why not? Let them know. You got to ask questions in order to help yourself. So I think my epitaph would be, Christine always asked questions.
Now I'm gonna phrase it a little bit differently, because I think you said something else to kind of hit on that. You said just a few seconds ago to your kids, you said all they can tell you is yes or no, and if you don't ask questions, you don't have the things to help yourself.
I'm not going to get the answer. That's
right. So I'm going to say for you, because this would be your chapter, you should ask questions to get help for yourself.
Yeah.
Does that kind of sound?
That'll work. That's how To help yourself, ask questions.
To help yourself, ask questions. Okay, I'll say it like that. To help yourself, ask questions. And I'll probably put under there, they can only say yes or no. Yeah. Okay. That'll be your chapter.
I like that. Thank you.
I try to sum things up. I try to listen and sum up, because I want it to really reflect on your story and what you
I like that.
Yeah. You see. So anything else you want to share before we get off? We're gonna pretty much close out now.
No, that's about all I can add to that.
Okay.
Unless you have more questions for me.
No, that's pretty much it. We did great with that. I really appreciate you doing. I really do. I think my goal is just to get this out. I mean, it's just one of many that I got in my belly. So I mean, I just think it's time. If anything that we can do from my perspective to educate and get it out there, that's what I'm going. That's what my aim is. So.
I think that's a wonderful thing you're doing.
Yeah. Thank you so much, and we'll hear from you again, hopefully. So, God bless you. Okay. Keep it going.
Thank you so much.
Okay,
and have a good night.
You too. Bye bye. Okay, so we thank Christine for her story. Next episode, we will continue to expand upon the consequences of delayed intervention. As we saw that Christine not only developed chronic regional pain syndrome, but also she developed a frozen shoulder. But we're also going to bring on another guest next week so she can tell her story of some of the consequences of delayed intervention, as well as try to dive in a little bit more into that post-traumatic osteoarthritis concept. And then as the weeks goes, we'll expand on more. Listen, if you feel that you have a story that's worth telling, please fill out the form on our website for us to get in touch with you, because the whole purpose of this is to achieve change. Thank you for tuning in today at Let's Achieve Change. Don't forget to like, share, and subscribe. You will find out more about Metanoia Education and Wellness Center on our website at changeachieve.com. We welcome your questions and your feedback. Please feel free to fill out the form on the website and we will contact you directly. I pray that you prosper and be in good health, even as your soul prospers. Remember, it's all about the change. Thank you.